Hello, friends and my viewers. How are you? Welcome to my Health Inbox series. I'm Dr. Renu Sharma, professor in a medical college and a clinical nutritionist. Now, the latest information is that you shouldn't be considering BMI as an indicator of obesity or measuring obesity. Instead, some new changes have been done which should be considered for considering yourself obese or not. Okay. So, first, the opening line would be very interesting. That is, contradictory as it seems, malnutrition is a key contributor to obesity. Now, you will think about this statement that why malnutrition is considered as a key contributor for obesity. Because, see, we are eating food. Majority of the people, they are growing obese, which we say is you can say energy surplus condition. That is, you are eating more than required, so you are storing more of fat. Okay, that is a general you can say definition for obesity, which the people understand, that when we are eating more, we are growing more of fat, we are depositing more of fat in the body than we are expending, then that is making us obese. Okay, but are we eating right? Okay, the food which we are eating is not providing us the adequate amount of minerals or nutrients which we require. So basically, we are depriving our body of the healthy components or natural you can say components which are present in the food items, that is the nutrients, minerals, antioxidants. Okay, all these are not present in the food we are eating, mostly the outside food, the junk food, the processed food, the ultra processed food, high amount of sugar, fructose. So basically, when we're depriving our body of all these healthy ingredients, then we are malnourished. So this is what is the new definition of obesity. You are not nourishing your body properly. You're depriving the body of the healthy components, and that is why you're growing obese and you are making your metabolism dysfunctional and going towards chronic illnesses. Now, what is the new criteria for defining obesity? That is, BMI was considered as the, you can say, the main point. That is the calculation to find out if you are above a particular level of BMI, then you are considered as obese or mildly obese or severely obese or like that. Okay, humans may be like this article has been printed in the Times of India yesterday. They have started this that humans may be tall, short, broad, slim, and all are normal. But Adolf Kittlett didn't like that variability. The statistician in him, he was also an astronomer but not a physician, aged to neatly quantify the normal man. So in 1832, he created an index dividing person's weight by square of its height. And that way he find out that term, that is BMI. Okay, that's fine. You are overweight if your BMI is over 25. You are obese if it is above 30. For example, height is 5 feet, weight is 70 kgs. So you're considered obese if you find out the BMI. BMI, body mass index simplicity, is its beauty and also its drawback. It's very simple. You are just taking the weight of the person in kilograms, dividing it by the height, the square of the height in meters, and then you're finding out that value, and then you're uh, grading them person as overweight, obese, or like that. So when Mike Tyson fought Evander Holyfield in 1996, he weighed 100 kilograms on a 5 feet 10 inches frame, BMI 31.9, almost 32, an absurd case for weight loss drugs like Ozempic. On the other hand, you have a 5 feet 10 inches office worker weighing 72 kilograms, healthy BMI of 22.7, who suffers a heart attack. So on one side is a person who is a sports person, okay, with a abnormal BMI. Okay. But that person is not unhealthy. On the other side is an office worker who has a perfect BMI but is unhealthy and has suffered a heart attack. So, do you think that BMI is really, really making you aware of your situation, what is going on in your body, what are the metabolic dysregulations happening, and whether you will be suffering from any chronic illness or not? So, basically, it's not defining that category, it's just giving you numbers. Turns out that sitting for too long atrophied their muscles and piled weight around the middle, which is a risk factor, major risk factor for diabetes, heart trouble, and also cancer. That is when you are collecting fat on the abdominal area, which is known as visceral obesity. That is the most important marker for defining yourself as having metabolic dysfunctions and lending you towards chronic illnesses, because that is the most metabolically and endocrinologically active fat which is collected on the visceral area or abdominal area. Okay, that releases inflammatory mediators which harms your fat, your liver, makes it fatty, and that is basically the starting point of making you insulin resistant and targeting various other organs. And there's a flare of inflammatory mediators. So basically it's starting with inflammation, which is starting from the deposition of fat in the visceral area or the abdominal area. Okay, so a Lancet panel has called for defining obesity in better terms such as the waist to hip ratio or waist circumference. Okay, that is, you have to measure the waist circumference. It is around, if it is more than 35 centimeter in females, then they are considered as unhealthily obese, and if it is around 40 centimeters more in males, they are obese. Early last year, the world's obese population, not merely overweight, was estimated over 1 billion. And data shows obesity is no longer a rich world problem. Not only the rich people, poor people, rural area people are also suffering from this. The island nation of Tonga has the highest share of obese people thanks to a steady supply of cheap mutton flaps from New Zealand. Egypt's economic woes have resulted in an obesity pandemic as people are eating less rice, vegetables, and legumes and more of meat and sugar heavy foods to feel fuller. Obesity is not so prevalent across India, but that's mainly down to lower rates in villages. One study found that 70% of India's urban population was already overweight or obese, and rising consumption of ultra processed foods could make the problem worse. A better measure of obesity, one that distinguishes between fat and muscle, that is, how much fat you have, how much lean muscle you have, abdominal fat, and other types, and takes into account differences of race and sex, would be welcome. Okay, so it's like population is growing obese whole in the whole world. In India also it's growing enormously, and this basically has to be you can say corrected only, and that is possible only when we are eating right. So we have to abstain from eating lots of ultra processed foods and high sugar salt foods and high fat foods. Okay, instead we have to switch over high fiber foods and healthy fats and proteins, so that we get a good mix of all these nutrients along with various minerals, and all that we'll get only if we are eating natural home cooked and clean food. That is only possible with that only. So if we don't take care of all these eating habits, then over a period of time this visceral obesity is going to make us ill, chronically ill, which will then make it difficult for us after having a disease to reverse those diseases. Okay, so whatever kind of gimmicks the food companies give you, whatever kind of gimmicks the drug companies give you, that we have the weight loss drugs, the Ozempic and all that, that is not a permanent solution. One cannot just easily lose weight through taking drugs. They have their side effects also. And food companies might be labeling their foods like healthy, high fiber, you can say, I know, healthy fruit juice or high fiber juice, real fruit juice. But then you have to pay attention to your knowledge. You have to gain that you can say intellect, that this is not at all possible, that in a packet which is processed already, you are getting the natural form of that fruit or vegetable. That's not at all possible on earth. Whatever kind of convincing data they give, or whatever kind of, you know, things they point out, but it is totally unhealthy. You cannot replace natural vegetables and fruits with a packet or packaged or canned food, whether it's a fruit juice or it's vegetables or anything which has been pre-cooked and packed in it. Anything which is packed, packaged, and have added preservatives, emulsifiers, lots of chemicals which you don't know also what they are. They are really toxic to your body. You're putting poison in your body. That's it. I'm going to finish this video with that only, that you are eating poison. So you have to decide whether you have to switch from this poisoned food to a natural, clean, home cooked food. That you have to decide. Take care. Bye.